And what I will show you today or share with you is an example of what we are doing, also involving the UOC and the EL Center to tackle the, let's say, phenomenon of aging and its negative consequences, but opening the solution to the participation of the community and older adults themselves. So this is our experience of the Barcelona Aging CoLLaboratory, which is an aging living lab. And I will walk you through also the different institutions that are part of this platform, including WOC, including my hospital and provider of primary healthcare, and our research institute, VHIR. So all this project and this idea, of course, stemmed from the, let's say, observing that population is aging very quickly in Spain, but also in many other countries of the world. So I don't have to, let's say, show you the figures and the numbers because you are perfectly aware of the aging phenomenon. And of course, the COVID-19 pandemic has been showing us even more the importance of caring for the health of these people with the preventive actions and also reactive actions. Our idea is that more and more people will need service and products for their, let's say, to age better somehow. But the point is that we need to involve them as producers and not only as consumers. So we have to involve them in the solution and not only think about and develop solution for them. Because in many cases, what we can think will not adjust completely to their needs. So we have to take them into account from the beginning, okay? And as another, let's say, base, why a living lab? So we do quite a lot of aging research, but much of the research is a waste. And this is not only in aging, in many other fields, because research questions are not relevant to the people that are gonna use, let's say, the data and the results and so on. The methods sometimes are not appropriate, the publications are accessible and so on. But this is even more important for older people because in many cases, older people are excluded from, for example, clinical trials. Why? Because they present a lot of different health conditions, they have social problems and social needs, and this is challenging. So it's complex to do research with these people, and also it's associated with high costs. But this is a problem because sometimes we come up with, I don't know, a medication, a device, a service, or something that has been tested in different populations, but we apply to older populations. So we translate the concept, but it's not the same, okay? So this is why we created the Living Lab, okay? The Living Lab, the proposition, the core of the Living Lab is, I don't know if you are familiar with the concept of the Living Lab. Sometimes somebody says yes, and I'm glad about that because I removed for brevity the slide on the Living Lab. So the Living Labs in general are a very heterogeneous concept. It was created from the design perspective, so to design, let's say, furniture, taking into account the needs of the people that was going to buy this furniture, but it can be applied to different other settings. And it's an ecosystem taking into account different stakeholders, which I will show now, to co-create and test solutions, which in our case are services, I would say also pathways, services, pathways, policies, and products, okay, with different stakeholders, but mainly the end users, so older people and their caregivers, okay? As you say, the theory of the Living Lab, they talk about the quadruple helix. So a Living Lab has to have inside research, end users, companies, so enterprises, and public administration. We have a fifth helix, a fifth part of the helix, because coming from the aging providers and aging research, we need to have healthcare professionals and also social care professionals and third sector in the Living Lab, okay? And all this is represented here in the different institutions. So here we have healthcare providers. This is an institution, eSocial, merging together a different of other institutions providing social care, okay? We have research here and also university walk and another university on healthcare. We have Institute of Robotics and Industrial Informatics. We have 3 companies, so medium and small-sized enterprises on digital application and health, providing caregivers at home, and these are architects for healthy spaces, okay? But most important, we have one from the very beginning, the Catalan Foundation of Aging, so old people. So this is a federation of association of more than 4,000 people around Catalonia, managing day centers and doing activity to, let's say, foster healthy aging. And so these are retired people that are on board in the Living Lab from the very beginning, from the very first idea, okay? And now we are summing up different other institutions, such as, for example, the Stroke Patients Association of Catalonia also joined the Living Lab, and more are joining. So we really need these core activities of end users, okay? So how do we do, or how we do that? So I will come on this later, but we are going from the macro to the micro. So we want to do systemic diagnosis and create communities of practice to, let's say, detect needs and develop operative plans or strategic plans, but also we want to co-design and implement complex intervention, mainly services, with or without digital products, and also, of course, products, okay? So we have a lot of expertise in different things. We have access to different older populations, co-creation methodology, design and validation of digital technology, education and competitive research. Where we do this on site. I will show you the space we have, but also through virtual, let's say, connections with users. We got quite a good expertise on that, on developing like participatory dynamics through online connections. And we want to be funded through different ways to be sustainable. As I say, these are the different institutions that are part, let's say, funding members of the Living Lab. And this is our like home, okay? This is a small house donated by IKEA, okay? Because IKEA was interested in working on the house of the future for older people, okay? So they started the project and then they donated us this space, which is like chill out space, I would say, to put together groups of older people and caregivers and run discussions with them, okay? But also in the hospital, this is our hospital, we have simulation spaces. So as no, it's very similar to what you showed. We have 2 little flats with everything, even the kitchen and the bathroom or the shower. And so we can also test and simulate solution there, besides having more than 300 people here and primary care and so on. So just some examples of what we are doing now. So from the micro products to the services development and communities of practice. So we have, this is micro, for example, we are developing with the Institute of Robotics a robotic arm to help feeding older people with disability, okay? And these are participatory groups of health professionals, but also we hold participatory group of older people to really add which skills this robot should have to be really helpful for older people. And this is also very interesting because it generated also a nice debate on, let's say, ethical aspects and social aspects of assistive robotics, okay? Or another thing which is also micro, so it's a product, even if it's a very different type of product, is the development of toolkit of indicators, so meaningful indicators for older people who receive home care. Okay, so we are doing a systematic review, but also we want to work to these indicators with the end users. Okay, so which are these proms and prems, so experience and different measures, okay, related to the care, received care and their perception, okay? Also in the micro list, there is an application to help healthcare professionals to prescribe exercise, or now we hope to work to improve the vaccination, okay? So with the Catalan Health Public Health Agency, to understand from the perspective of users how we can improve the vaccination strategies in the region, okay? And going very quickly to the end, I would say. So this is in the meso layer, so new services. So we were funded of a large project for integrated care, so integrating health and social care for older people, and we are developing a shared evaluation model and a treatment plan between health and social sector providers, but we need the Living Lab to really validate the solutions, so the model and also the technologies to connect health and social professional with other persons and caregivers. So this is something that the Living Lab can also do. And finally, the community of care, the community of practice, sorry. From the macro perspective, we are creating a community of practice. We are meeting with these people from a specific neighborhood of Barcelona that come every 2 weeks. So they decided, for example, at the beginning, so we did the brainstorm on different challenges to develop, like say, age-friendly society. And so they decided to start working on the retirement process. So what should we do to retire with, let's say, in a better quality of health and mental health and so on. So they are working on this. This is the Ball Cafe, and we want to create this community of practice that can help us and be a stable community to really work on challenges related to aging. So we are online also and aligned with different priorities of the Decade of Healthy Aging by the UN and WHO, as you see, voice and engagement, connecting stakeholders and so on. And this is our, let's say, starting project, because it has like few months of life, but we hope to tell you more in the future about that.